As a heart surgeon, I'm warning this pill weakens senior hearts and increases stroke risk. As a heart surgeon with decades of experience, I've had countless senior patients walk into my office fearing the worst, a potential heart attack. They describe a sudden onset of chest pain, shortness of breath, or a profound and alarming fatigue. And often, the hidden culprit isn't just age or diet. It's a common pill they trust, a pill that is silently weakening their heart and significantly increasing their stroke risk. What many seniors don't realize is that some of the most common medications can damage the heart muscle, leading to conditions that are the primary causes of a heart attack, or they can promote clots that travel to the brain, causing a stroke. The danger is twofold, and understanding the difference between a heart attack versus stroke and how these pills contribute to both is critically important. This isn't about fear. This is about arming you with the knowledge to protect yourself. This is how you truly learn how to prevent heart attack and lower your risk of a stroke. Today, I will reveal 7 common medications that can quietly weaken your heart, increase your risk of a stroke, and lead to other cardiovascular events. This list is built on what I've witnessed in the operating room and in patient follow-ups. If you or a loved one is over 60 and taking medication, this information could be life-saving. I am not asking you to stop any medication, but you have the right to know the truth. Let's begin the countdown with a pill found in almost every family's medicine cabinet. Pill number 7, non-steroidal anti-inflammatory drugs. NSAIDs, non-steroidal anti-inflammatory drugs, or NSAIDs, include extremely common medications like ibuprofen, Advil, Motrin, and naproxen, Aleve. So many of my senior patients rely on them for daily pain relief from chronic arthritis, back pain, or joint pain. But here is the dangerous reality. These are not harmless candies. NSAIDs can raise your blood pressure and cause fluid retention, creating a terrible burden on your heart. For an aging heart, this added pressure can be the tipping point that leads to heart failure. This is especially critical for my female patients because the heart attack symptoms in women are often more subtle, such as fatigue or shortness of breath, and can be easily mistaken for the medication's side effects. Swelling in the ankles or sudden shortness of breath are not just minor side effects. They can be the early warning signs of heart attack or progressing heart failure. Over time, continuous use can damage blood vessels and impair kidney function further, increasing the risk of a stroke. That's why I am always firm with my patients. Pain relief should never come at the cost of a heart attack. If you need to take NSAIDs for more than a few days, talking to your doctor is an absolute must. Let's move on to pill number 6, one that is even more dangerous over time. Pill number 6, certain diabetes medications. Thiazolidinediones. If you are managing type 2 diabetes, there's a class of medications called thiazolidinediones, which includes drugs like pioglitazone. They are designed to lower your blood sugar, but they can silently harm your heart. These pills can cause fluid buildup, swelling in the legs, and even lead to congestive heart failure, especially in seniors over 60. While the intention is to manage blood sugar, the hidden risk to your cardiovascular system is serious. Many seniors with diabetes are already at high risk of heart disease. When you add a drug that puts more pressure on the heart by causing the body to hold extra fluid, it becomes a dangerous combination. Untreated heart failure is a direct pathway to catastrophic cardiovascular events, including a heart attack. What's even more troubling is that these pills can mask the early symptoms of heart failure, like tiredness or shortness of breath, subtle signs that can sometimes mimic female heart attack symptoms. Some doctors may still prescribe them because they are effective for blood sugar control, but if you have a history of heart disease or even mild swelling, this medication can silently accelerate the damage. Always ask your doctor if a safer alternative is available. Your blood sugar matters, but not at the cost of weakening your heart. Let's now move on to pill number 5, which millions of seniors are still taking for sleep every night. Pill number 5, sleeping pills. Sedative hypnotics. Many seniors struggle with sleeplessness and rely on sedative hypnotic medications like zolpidem or older drugs like diazepam. These pills promise a better night's sleep, but they often come with serious consequences for your heart. Sedatives slow down your entire nervous system, including your heart rate and blood pressure. While this may sound helpful, it actually lowers your body's ability to respond to stress or oxygen demands during sleep. Over time, these drugs can cause or worsen sleep apnea, a condition where you stop breathing for short periods during the night. This puts extreme pressure on the heart and can lead to dangerous heart rhythm disturbances, one of the leading causes of a stroke. Additionally, these medications can interfere with essential heart medications, such as beta blockers, making your treatment less effective and leaving you vulnerable to the very heart attack you are trying to prevent. The risk of falls confusion and breathing problems further increases with age, especially for those taking other medications. Poor sleep must be addressed, but long-term dependence on sedatives can slowly harm your brain and heart. There are natural and safer ways to improve your sleep without this damage. Talk to your healthcare provider before continuing any sleeping pill regularly. We'll now move to pill number 4, a common mood stabilizer that might be slowly hurting your heart without your knowledge. Pill number 4, tricyclic antidepressants. Tricyclic antidepressants are older medications prescribed for depression, anxiety, or chronic pain. Drugs like amitriptyline or nortriptyline were once very commonly used, but they come with heart risks, especially for people over 60. These medications can cause a variety of cardiac issues, such as irregular heartbeat, blood pressure changes, and even a dangerous condition called heart block. Over time, they can interfere with the delicate electrical signals that control your heartbeat. This makes them particularly dangerous for seniors who already have arrhythmias or a slow heart rate. This disruption in the heart's electrical system can lead to serious events, and this is one of the answers to what are the causes of heart attack that few people consider. These drugs also increase the risk of dizziness and falls, which can lead to injury and further complications. Even if the dose is small, taking them for long periods without monitoring can be harmful. There are newer antidepressants that are much safer for the heart and brain in older adults. Unfortunately, some doctors still prescribe these older medications out of habit or due to cost concerns. If you are taking a tricyclic antidepressant and feel tired, dizzy, or have heart flutters, symptoms that can sometimes be mistaken for the first signs of heart attack, do not ignore them. Always ask your doctor if there's a safer alternative. Up next is pill number 3, and it's something that millions of seniors are taking daily for a very common issue, but with hidden risks. Pill number 3 decongestants, pseudoephedrine and phenylephrine. Decongestants like pseudoephedrine and phenylephrine are found in many cold and allergy medications. Seniors often use them to relieve nasal congestion or sinus pressure, especially during seasonal changes. But these pills can be very dangerous for your heart. They work by narrowing blood vessels to reduce swelling in the nasal passages. However, they also narrow blood vessels throughout your body, including those that supply your heart. This raises your blood pressure and forces your heart to work harder. For seniors, this extra strain can be dangerous, especially if you already have high blood pressure or heart disease. These pills can also trigger irregular heartbeats or palpitations. You may feel jittery, anxious, or even dizzy after taking them. That's your heart telling you something is wrong. Knowing what does a heart attack feel like isn't just about chest pain. Sometimes it starts with unusual sensations like these. Many people assume these medications are safe because they're sold over the counter, but age changes how your body reacts, and what once felt harmless in your 40s can now be a major heart risk. Always read labels carefully and talk to your doctor before using any decongestant. Let's move on to pill number 2, one that seniors often take for long-term acid reflux without knowing its silent effects on the heart. Pill number 2, proton pump inhibitors, PPIs. Proton pump inhibitors, commonly known as PPIs, are medications like omeprazole or pantoprazole used to treat acid reflux and heartburn. Millions of seniors rely on these pills daily, believing they are completely safe. But recent studies have shown that long-term use can increase the risk of heart problems. PPIs reduce stomach acid, which is helpful for reflux, but that same acid is also essential for absorbing key nutrients like magnesium. Low magnesium levels can lead to irregular heartbeats, fatigue, and even muscle weakness. Over time, PPIs can also disrupt your gut bacteria and contribute to inflammation, a process directly linked to heart disease. This chronic inflammation is one of the fundamental answers to the question, what causes a heart attack, as it can make plaques in the arteries unstable. If you are taking PPIs for more than a few weeks, and especially if you are over 60, it's time to reassess. These medications should only be used for short-term relief unless absolutely necessary. If you're experiencing persistent heartburn, work with your doctor to find the root cause rather than just masking it. Long-term heart health must always come first. Now it's time to reveal pill number 1, the most dangerous and commonly used pill that is quietly weakening senior hearts across the world. Pill number 1. Calcium channel blockers. Calcium channel blockers are medications often prescribed for high blood pressure, chest pain, or arrhythmias. But certain types, especially older ones like verapamil and diltiazem, can be dangerous for seniors. While these pills are effective at relaxing blood vessels, they can also slow the heart rate too much. For seniors whose heart function may already be reduced, this can lead to dangerously low heart rates, dizziness, and even fainting. Over time, they can cause swelling in the legs, shortness of breath, and heart rhythm changes. These symptoms aren't just discomfort. They can be the signs of heart attack or of worsening heart failure. Some calcium channel blockers can also interfere with other medications seniors often take, increasing the risk of complications. The biggest issue is that many seniors are prescribed these without regular monitoring, and side effects may be blamed on age rather than the drug itself. If you are experiencing fatigue, swelling, or a slow pulse while on these medications, it could be a warning. Never stop heart medication without your doctor's supervision, but always ask if there's a newer, safer option for your condition. This pill is powerful, but it needs close oversight. If you're over 60 and taking any of the pills we discussed today, I am not telling you to stop them on your own, but I am urging you to talk to your doctor. These pills were designed to help, but when taken long-term or without proper monitoring, they can slowly damage your heart. As a heart surgeon, I've seen too many seniors hospitalized not because of illness, but because of the side effects of their medications. The goal is not fear, it's prevention. Understanding the warning signs of a heart attack is important, but recognizing the hidden risks in your prescription is even more critical to prevent a heart attack from happening in the first place. With the right awareness and support, you can protect your heart, live longer, and feel better. Now is the time to take control of your health. Stay informed, stay alert, and never be afraid to ask questions about the pills you're taking. Your heart is too important to ignore. If you found this video helpful, please share it with your loved ones and subscribe for more life-saving advice tailored for seniors like you. Take care and stay heart strong.